Hello, lovely people. A wonderful day to you. This is Dr. Chumisi. Welcome to the Ghanaian Doctor. Today, we are going to talk about hepatitis B. Hepatitis B is a viral infection. It's a DNA type virus that usually causes inflammation in the liver. The name is actually from the word hepa or hepatocyte, which is a liver cell, and inflammation or itis. So there are like 5 different viruses that cause inflammation in liver. We have hepatitis A, B, C, D, and E. There are others, but these are the commonest. And hepatitis B is among the commonest type that we know of. Usually it's transmitted through blood, through sexual intercourse, and through other means. We'll come to that very soon. And usually transmitted together with hepatitis D. So B and D usually go together. And then, so usually when you're infected with hepatitis B, you are at risk of getting hepatitis D. And then we have hepatitis C as well, which is also a very dangerous cause of hepatitis. Then we have hepatitis A and hepatitis E, which is usually transmitted through diets. You understand? So hepatitis A, hepatitis E are transmitted through diets. Hepatitis B, hepatitis C is transmitted through blood or sexual intercourse and all that. So that's the basics of hepatitis. Let's talk about viruses. There are many different kinds of viruses in this world. We have computer viruses and we have human viruses. Okay, let's get to the serious bit. So basically, we have all kinds of viruses. There are some viruses that are quite harmless. Even as you talk to me right now, there are probably some viruses in your house, on your skin, lying on your table, which are quite harmless, just living their lives. There are viruses everywhere we look, viruses on our knives, on our plates, in our bodies, in our stomach. There are viruses everywhere, but most of them are quite harmless. And then there are some viruses that cause mild infections in the body, like common cold, usually from viruses. You go to your hospital, you have a cold, your doctor will tell you to just, drink some water, have some rest, and probably he will advise you to take some vitamin C, or maybe you have some diarrhea. Your doctor will tell you to take some ORS, to drink a lot of water. It's because these conditions are usually caused by viruses, and most of the time the body clears it without any particular intervention from the medical doctor. So yeah, there are those viruses as well. And there are some viruses too that are quite stubborn. They cause rashes. You've heard of the chickenpox virus, which will cause a rash all over the body. We have viruses other than chickenpox. We have viruses that will cause ulcers on your lips, cold sores, cold sores like on your lips and then around the genital area. So some viruses can cause some ulcers there. Herpes is a virus. So it's important I'm mentioning chickenpox. I'll come to that in relation to hepatitis B very soon. So those are some kinds of viruses as well. And then you can jump over to the big name, HIV, also a virus, which causes suppression of the whole immune system and crashes your immune system and allows other infections to come in and have a party and cause a lot of problems to your body. So those are also viruses as well. Now, hepatitis B virus is similar to chickenpox virus in the sense that when it comes, it can lay dormant. Chickenpox virus can lay dormant in your nerves for several years before later it will come out as shingles or wanansi. Yeah, chickenpox can lay dormant in your nerves for a long time and then later it comes out as shingles. In the same way, hepatitis B virus, when it gets to the liver, it initially lays very quietly. And while it's quiet, it's not lazy. It divides itself over and over and over. It begins to divide itself. And usually, when the body first recognizes that this virus has come to the body will send its soldiers or its immune system to go and try and subdue and cancel out this virus. Unfortunately, most of the time, in fact, all of the time, the immune system is unable to, clear the virus, and the virus ends up, in that small cocoon area of the liver, and it begins to replicate over and over again. Because of this initial immune system response, initially you may have some small fever and some small chills when you initially have the virus. But then most of the time, the immune system is not going to actively be able to handle the virus. So these symptoms will resolve in a few days or in a few weeks, and then you would think you're fine, but then the virus is dividing and replicating and dividing and replicating and just biding its time. So basically, that's what happens in the beginning. After several years or several decades, there comes a time when your body is under stress, your system is under stress. There comes a time when there is a trigger that tells your body that, that there is a problem, either from stress or from any other trigger. But whatever the case, sometimes you don't even know what trigger actually brings it. But after several years or decades, this virus can reactivate, and this is when it becomes a big problem. When it reactivates, in some cases, it causes a very severe form of hepatitis, a very severe form of liver inflammation called fulminant hepatitis. Now, this kind of hepatitis is so severe that it can shut down your liver in months. So usually that is one big complication that hepatitis, the quiet hepatitis B, can become. It can become very, very aggressive all of a sudden. Apart from changing into this kind of fulminant hepatitis, it can become active and cause certain symptoms, which I'm going to describe right now. The symptoms of hepatitis B span a spectrum. It can span a spectrum all the way from having no symptoms, where there are no symptoms, it comes, you're fine, everything is perfect, you don't feel sick, everything is perfect, but you still have hepatitis B. That's one aspect. Or it can go all the way to the other spectrum where, it makes you confused, it puts you in a coma, it crashes your liver and all that. Of course, most people will be somewhere in the middle or somewhere at, towards the end of the spectrum where there are no symptoms. But then, let's talk about the symptoms. Usually, it can come with yellowing of the eyes, what we call jaundice. It can come with this discomfort or pain in your abdomen. It can come with some discomfort in your abdomen around the upper right area. It can sometimes come with a swelling of your abdomen. It can come with shortness of breath where you cannot breathe because, some fluid will be in your lungs, in the bottom of your lungs. It can come with confusion, like I mentioned. It can come with kidney failure. It can come with liver failure with all its attendant, complications. I think I'll have to probably cover that in a different video. But the liver is important for regulating glucose, for making sure your blood will clot. So when you're bleeding, make sure that you stop bleeding and all that. The liver stores so many important, nutrients and important storage stuff. So when the liver function is, affected, all of this is compromised. So that is something I'll cover in another video. So it can cause the liver to fail and all of that. Apart from that, you can have some fever, you can have some weight loss, you can have some, night sweating, you can have some difficulty eating and all that. So these are all different ways that hepatitis B can present. But on most occasions, we only pick hepatitis B because someone is feeling unwell, either from a different illness or from, maybe malaria or something. And then we do a routine screen and we find out that, oh, this person has hepatitis B. Or maybe they are getting married and then their pastor advises that, they do a sexual screen, and then we find hepatitis B. So sometimes it's routine, there are no symptoms, but we find it. Okay, let's talk about the transmission. I think I left that out. Hepatitis B is usually transmitted through 3 different ways. The first one is from the mother to the child. In places like Sub-Saharan Africa, where Ghana is located, this is the commonest transmission route of hepatitis B. So most of the time, if you find out a man or a woman who is getting married has hepatitis B and the person is a virgin and has never had sexual intercourse, sometimes it's because the person got it at birth. And also, there are lots of recorded cases of hepatitis B in children between the ages of 1 to 5. So it's not always that it is linked to sexual intercourse. So that's like the commonest cause, from mother to child. And also it's transmitted through sexual intercourse, like most of us know, through vaginal secretions and through semen. Then the final route is through blood, through blood transfusion, or if you're using a sharp object, for example, you are barbering someone's hair, and the blade cuts you, that contact, can put you at risk of something like hepatitis B. Your doctor or a nurse, given an injection. If that injection, after pricking the patient, pricks you, you're at risk of, getting hepatitis B infection. So anything that puts you at risk of, contact with bodily fluids like blood, like semen, like vaginal secretions, you should always make sure that your vaccination, bed is up to speed. So if you come to the hospital and you are seen to have hepatitis, usually on most occasions, your doctor will do a few investigations for you, which will determine whether you have to be treated or you don't have to be treated. So these investigations are several. The first one is we check your liver function. Is your liver function all right? If your liver function is fine, good news. If your liver function is affected, we may have to investigate why and then do further tests. Secondly, you look at your hepatitis B profile. Now, the profile looks at the various, subunits or the various parts of the hepatitis B virus which are seen in your blood. So, if certain aspects are seen in your blood, it means that the hepatitis B is actively dividing, actively dividing. If certain factors are also seen in your blood, it also shows that the hepatitis B virus is currently just calm, has finished its dividing or is not dividing at the moment and is very calm. So depending on the kind of, subunits or aspects of the hepatitis B we see in the blood, we can determine if the hepatitis B is active or if it is just quietly lying down. So this is what we call the hepatitis B profile. Apart from that, we look at the hepatitis B viral load. Now, the viral load looks at the number of individual hepatitis B viruses is currently in your blood. So depending on the viral load, it will show whether your immune system is controlling the hepatitis B well, or if it is overwhelming the immune system, or if there's a battle and your immune system is winning or losing. So basically, if the number of copies or the number of individual hepatitis B viruses are super high, then it gives an idea that your immune system is not doing a very good job and that very soon we may have a problem. If the number of hepatitis B viruses, that we pick up in the blood during the viral load is quite small, then it shows that either the virus is not actively dividing or your immune system is doing a very good job. In that case, we are not in a hurry to treat you. And then, of course, we do a scan, an ultrasound of your liver. The scan will show if there are any complications of the hepatitis B, like any cirrhosis where the liver shrinks, or any cancer, hepatocellular carcinoma, where the hepatitis B transformed the liver into a cancerous state. The scan will also look at your kidney, make sure that there are no complications from the hepatitis B. Looks at your lungs, looks at the rest of your stomach to see that there's no fluid or any complications of the hepatitis B. So after your doctor does all of these tests, you put it together and determine whether you need to be treated for hepatitis B or not. On most occasions, we do not actively treat hepatitis B. The reason is that hepatitis B virus is not curable. What do I mean by it's not curable? When you give antiviral medications for hepatitis B, what it does is it controls the infection. However, if you stop the medication, the infection reactivates or the hepatitis B virus reactivates. Currently, science doesn't have a drug that can completely clear hepatitis B from the system. So because of that, all we can do is control the hepatitis B virus if it is very high, so that it doesn't give you any symptoms. So in most people who have hepatitis B and don't have any clinical, symptoms, who have hepatitis B and then they are fine, the viral load is quite low, the liver is not showing any symptoms of, stress, any symptoms of, failure. The scan shows a normal liver, normal kidney, normal, everything in the abdomen. If all of these are fine, and then, the hepatitis B profile also shows that the virus is not actively dividing itself, the doctor most of the time will advise you to come for regular follow-ups just to make sure that in case anything changes, we can quickly catch it. However, if we do your labs and we realize that your liver function is shooting all over the place, hepatitis B profile shows that the virus is actively dividing. The viral load shows a very high viral load. Your immune system cannot cope with it. There are any abdominal scan changes showing that your liver is beginning to have changes or other complications from hepatitis B virus, then we actively treat. How do we treat? The antiviral medications available. Some of these medications can treat other infections, but the antiviral medications available for treating hepatitis B. The problem is that these same antiviral medications have certain side effects on the liver and other aspects of the body. So we only use them when we absolutely have to use them. And the interesting thing too is that when you go on to hepatitis B treatment, it's lifelong. The truth is that when you pause the treatment, the hepatitis B virus can reactivate. So unless there are very unique instances where we need to pause the treatment for you, immediately your doctor determines that you have to start a hepatitis B treatment, it is lifelong. So this is something we should note. There are several complications of hepatitis B, which you should note. There's something called cirrhosis, where the liver shrinks and becomes less efficient. And then there's something called hepatocellular carcinoma, where it transforms into a cancer of the liver. And this kills quickly. And in fact, both of them leads to liver failure. Both of them leads to liver failure. So both of them can end your life in a couple of months, maximum 1 or 2 years. So these are the two major complications that you should note hepatitis can cause, in addition to all the others I mentioned about the kidneys, about the brain, and about the lungs and all that. How do we prevent hepatitis B virus infection? The commonest way to prevent it is through vaccination. By the grace of God and the Ghana government's, proactiveness, there's a lot of sensitization about hepatitis B vaccination. When I was in senior high school, for example, the team came to the school to vaccinate everyone, for hepatitis B. And there are usually 3 doses. You take one today, you take one a month later, and you take the last one 6 months later. Some people may need a booster, but a booster is not for everyone. So usually you take 3 shots, one today, one a month later, and then one 6 months later. So that's usually how it's taken. There are a few different vaccines with a few different regimens, but that's the commonest one that we use in Ghana. So, like I was saying, the government is very proactive. So, education about hepatitis B vaccination is quite advanced. So, I think most of us know about hepatitis B vaccination. Also, the government has this immunization program, the expanded immunization program, which, all our children, our babies go for this polio vaccination, go for measles vaccination. Hepatitis B vaccination is one of the medications that is used in children. So when you go for your routine vaccinations, most likely during one or two or three of the vaccination dates, your child will be vaccinated for hepatitis B. So that's it for the prevention. Vaccination is super important. If you are a health worker, if you are, you work in a prison service, if you are somebody who works with a lot of sharp objects like needles, like bleed, and all that, it would be advisable to honestly get your hepatitis B viral vaccination shots. Is super important, especially if you're not sure about, your vaccination schedule when you were a child. It's important to get it done. This is because the transmission rate can be quite high, and as much as possible, when you finish the shots, the vaccination cover is lifelong in most people. And a few people, 10 years later, they have to recheck, their titers to see if maybe they need a booster. But in most people, it's lifelong. So you do the 3 shots, it protects you for life, and you don't have to be scared of anyone infecting you with hepatitis B. So that's something that hopefully a few people who listen to me will take into consideration, especially those who work in these, sectors where they come into contact with blood or, secretions, vaginal secretions, semen, laboratory scientists, doctors, nurses, all of these people. You need to check your hepatitis B vaccination. And if you've done it, good. If you haven't done it, please, you have to update it as soon as possible and protect yourself. Now, before I go to, other means of preventing hepatitis B, so apart from vaccination, how else can we prevent hepatitis B viral infection? Well, there isn't much documented means of prevention apart from vaccination. However, there are some things you can do to improve your immune system so that even if you get an infection, at least your body will be strong enough to control the infection for a longer period. Some of the things include eating a very healthy diet, a diet rich in nuts, a diet rich in fruits, a diet rich in vegetables, a diet rich in wheat bread and not white bread. Eating such a diet helps to strengthen your immune system, and that's always good for you. Exercising regularly, at least 3 times a week, going on brisk walks, 30 minutes, to 1 hour, it helps. It keeps your immune system very strong. And then finally, making sure that you have enough time to rest is also one final medicine that you need to make sure the immune system is strong enough to fight and prevent any of these hepatitis B infections. So there you have it. that's a little I have for you on hepatitis B infection. Quite brief, but I think I would say that as much as possible, if you have been diagnosed with having hepatitis B, please communicate with your doctor, especially if you have a sexual partner. Communicate with the doctor, do your viral load. If you are, infectious, or your viral load is at a level where it can easily infect someone, speak to your doctor and let's do something about it, so they don't infect your wife or your partner. And then, of course, if your viral load is very, very high and it's a problem, we put you on medications. So please, if you have hepatitis B and you are listening to me today, please go to the lab, go and see your medical doctor, do your hepatitis B viral load, and then let's see if there's a problem. We don't want you to, as much as possible, infect your loved ones. And then, of course, if you have hepatitis B, let your loved ones get vaccinated. Let your children get vaccinated. Let your wife, let your husband get vaccinated, please. It's important so that you don't get the infection, so that we can control this infection and make sure that it doesn't continue spreading all over the country. There's a Ghanaian doctor, Dr. Chimesi. There's my 2 cents on hepatitis B viral infection. I hope you learned something. Kindly follow, like, and share this video with others. This is a Ghanaian doctor. Thank you for watching. See you on the next one. Bye.